Question 1. Benchmark analysis indicates that a licensed acupuncturist (LAC) is discussing a proposed treatment plan with a patient who expresses anxiety about the effectiveness of acupuncture for their chronic pain condition. The LAC has a strong understanding of the patient's medical history and the evidence supporting acupuncture for this condition. Which of the following communication strategies best aligns with regulatory requirements and professional ethical standards for patient interaction? Option A. Provide a detailed, technical explanation of meridian theory and Chi flow, assuming the patient will understand the complex physiological mechanisms involved in their pain relief. Option B. Emphasize the acupuncturist's extensive experience and success rate with similar cases, assuring the patient that their pain will be significantly reduced within a few treatment sessions. Option C. Briefly mention the treatment plan and then focus on the acupuncturist's personal belief in the power of acupuncture, without delving into specific outcomes or addressing the patient's expressed anxiety. Option D. Clearly explain the scientific basis for acupuncture's efficacy in managing chronic pain, outline the specific points and techniques to be used, and discuss the expected timeline for symptom improvement, while also acknowledging that individual responses can vary and encouraging the patient to voice any further questions or concerns. Correct answer is D. Clearly explain the scientific basis for acupuncture's efficacy in managing chronic pain, outline the specific points and techniques to be used, and discuss the expected timeline for symptom improvement, while also acknowledging that individual responses can vary and encouraging the patient to voice any further questions or concerns. Explanation. This scenario presents a professional challenge due to the inherent power imbalance between a licensed acupuncturist (LAC) and a patient, particularly when discussing sensitive health information and treatment outcomes. The LAC must navigate the patient's emotional state, potential misunderstandings, and the need for clear, accurate communication while adhering to professional standards and regulatory requirements. Careful judgment is required to ensure the patient feels informed, respected, and empowered in their healthcare decisions. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent, which are fundamental ethical and regulatory principles for LACs. By clearly explaining the rationale behind the treatment plan, potential outcomes, and acknowledging limitations, the LAC fosters trust and transparency. This aligns with the expectation that LACs will communicate in a manner that is understandable to the patient, allowing them to make informed choices about their care. This approach also implicitly addresses the need to avoid making unsubstantiated claims, a common pitfall in patient communication. An incorrect approach that focuses solely on the acupuncturist's perceived expertise without actively seeking patient understanding or addressing their concerns fails to uphold the principle of patient-centered care. This can lead to misunderstandings, unmet expectations, and potential dissatisfaction, undermining the therapeutic relationship. Ethically, it can be seen as a failure to obtain truly informed consent if the patient does not comprehend the information provided. Another incorrect approach that involves making definitive promises about treatment outcomes without acknowledging variability or potential limitations is professionally unacceptable. This can be considered a form of misrepresentation, potentially violating regulations that govern advertising and professional conduct. It sets unrealistic expectations and can lead to significant ethical and legal repercussions if the promised outcomes are not achieved. A third incorrect approach that dismisses the patient's concerns or questions, or communicates in overly technical jargon without clarification, demonstrates a lack of empathy and respect for the patient's perspective. This not only erodes trust, but also hinders the LAC's ability to accurately assess the patient's needs and concerns, potentially impacting the effectiveness of the treatment. It can also be interpreted as a failure to provide adequate patient education, a core responsibility of healthcare professionals. The professional decision-making process for similar situations should involve a commitment to active listening, empathetic communication, and clear, jargon-free explanations. Professionals should always strive to understand the patient's perspective, address their questions and concerns thoroughly, and ensure that the patient comprehends the information provided. When discussing treatment plans and potential outcomes, it is crucial to be honest, transparent, and avoid making guarantees. The focus should always be on empowering the patient to participate actively in their healthcare journey. Question 2. The evaluation methodology shows a patient presenting with fatigue, poor appetite, and a pale complexion. Considering the concept of balance in traditional Chinese medicine, which of the following diagnostic and treatment considerations best reflects a professional approach for a licensed acupuncturist? Option A. Focusing solely on the symptom of fatigue and recommending rest without further TCM assessment. Option B. Identifying the specific pattern of Qi and blood deficiency contributing to the symptoms and formulating a treatment plan to tonify Qi and nourish blood. Option C. Prescribing a general herbal formula known to boost energy without a specific TCM diagnosis. Option D. Suggesting the patient try a popular over-the-counter energy supplement to address their low energy. The correct answer is B. Identifying the specific pattern of Qi and blood deficiency contributing to the symptoms and formulating a treatment plan to tonify Qi and nourish blood. Explanation. This scenario presents a professional challenge because it requires the licensed acupuncturist L.A.C. to interpret and apply the core concept of balance within the framework of traditional Chinese medicine, TCM, to a patient's presenting symptoms, while also adhering to professional ethical standards and regulatory guidelines for practice. The L.A.C. must move beyond a superficial understanding of balance to a nuanced assessment of the patient's energetic state. The correct approach represents best professional practice because it involves a comprehensive assessment that considers the interconnectedness of the patient's symptoms, their constitution, and the underlying energetic imbalances, e.g., Qi deficiency, blood stasis, yin/yang disharmony. This holistic view aligns with the fundamental principles of TCM and the ethical obligation of an L.A.C. to provide individualized care based on a thorough diagnosis. Regulatory frameworks for L.A.C. emphasize the importance of accurate diagnosis and appropriate treatment planning, which are directly informed by a deep understanding of TCM concepts like balance. An incorrect approach that focuses solely on a single symptom without considering the broader energetic picture fails to meet the diagnostic requirements of TCM and may lead to ineffective or even detrimental treatment. This could be considered a failure to adhere to professional standards of care, as it bypasses the necessary diagnostic process. Another incorrect approach that relies on generalized, nonspecific interventions without a clear diagnostic rationale rooted in TCM principles also falls short. This lacks the specificity required for effective acupuncture treatment and may not address the root cause of the patient's imbalance, potentially violating the duty to provide competent care. Furthermore, an approach that prioritizes patient preference over a professionally determined TCM diagnosis without proper patient education and informed consent regarding the rationale for treatment could also be ethically problematic, as it may not align with the L.A.C.'s scope of practice and expertise. Professionals should employ a decision-making process that begins with a detailed patient history and symptom analysis, followed by TCM diagnostic methods, observation, palpation, pulse, and tongue diagnosis. This information is then synthesized to identify the specific pattern of disharmony, which is the TCM equivalent of imbalance. Treatment strategies are then developed to address this identified pattern, aiming to restore energetic equilibrium. Throughout this process, open communication with the patient regarding the diagnosis and proposed treatment plan is crucial, ensuring informed consent and adherence to ethical practice. Question 3. During the evaluation of a 45-year-old patient presenting with chronic low back pain that radiates down the posterior thigh, which of the following approaches best reflects a comprehensive and regulatory compliant best practice for a licensed acupuncturist L.A.C.? Option A. Recommend the patient consult a physical therapist for a biomechanical assessment and consider prescribing over-the-counter anti-inflammatory medication to manage the pain while awaiting the physical therapy evaluation. Option B. Immediately assume the pain is due to kidney deficiency based on the location and duration, and prescribe a course of acupuncture points commonly used for this TCM pattern without further investigation. Option C. Conduct a thorough patient history including onset, duration, aggravating and alleviating factors, and previous treatments. Perform palpation to identify tender points and assess muscle tension in the lumbar and gluteal regions. Evaluate range of motion and observe posture. Formulate a TCM diagnosis based on these findings and select acupuncture points to address Qi and blood stagnation and local facial restrictions. Option D. focus solely on palpating the lumbar spine for vertebral misalignments, and suggest spinal manipulation techniques that are outside the scope of practice for a licensed acupuncturist. The correct answer is C. Conduct a thorough patient history including onset, duration, aggravating and alleviating factors, and previous treatments. Perform palpation to identify tender points and assess muscle tension in the lumbar and gluteal regions. Evaluate range of motion and observe posture. Formulate a TCM diagnosis based on these findings and select acupuncture points to address chi and blood stagnation and local facial restriction. Explanation. This scenario presents a common challenge in musculoskeletal evaluation, where a patient reports pain with a clear anatomical location, but the underlying cause is not immediately obvious. The licensed acupuncturist (L.A.C.) must employ a systematic and evidence-based approach to accurately diagnose the condition and formulate an effective treatment plan. This requires integrating knowledge of anatomy, physiology, pathology, and the principles of traditional Chinese medicine, TCM, with the regulatory expectations for professional practice. The correct approach emphasizes a comprehensive assessment that includes a detailed patient history, observation, palpation, and functional assessment, all within the scope of practice for an L.A.C. This aligns with best practices that prioritize patient safety and efficacy of treatment. By considering the patient's subjective report alongside objective findings, the L.A.C. can develop a differential diagnosis and select appropriate acupuncture points and adjunctive therapies. This methodical process is crucial for identifying the root cause of the musculoskeletal pain, whether it stems from chi and blood stagnation, tendon ligament issues, or other imbalances recognized within TCM. Adherence to these diagnostic principles ensures that treatment is targeted and effective, minimizing the risk of inappropriate interventions. An incorrect approach would involve making assumptions or relying solely on a single diagnostic modality without thorough investigation. For instance, immediately attributing the pain to a specific TCM pattern without a comprehensive assessment could lead to misdiagnosis and ineffective treatment. This bypasses the critical step of gathering sufficient information to support a diagnosis, potentially violating ethical obligations to provide competent care. Another failure would be to recommend treatments outside the scope of practice for an L.A.C., such as prescribing pharmaceuticals or performing manipulations that are reserved for other licensed healthcare professionals. Such actions would constitute a clear regulatory violation and an ethical breach, jeopardizing patient safety and professional integrity. Professionals should approach such situations by first establishing a clear understanding of the patient's chief complaint and relevant medical history. This is followed by a systematic physical examination, incorporating both TCM diagnostic techniques and relevant Western orthopedic assessments within the L.A.C. scope of practice. A differential diagnosis should then be formulated, considering various potential etiologies. Treatment planning should be based on this diagnosis, utilizing evidence-informed acupuncture techniques and adjunctive therapies, with clear communication to the patient regarding the proposed plan and expected outcomes. Regular reassessment is vital to monitor progress and adjust treatment as needed. Question 4. Cost-benefit analysis shows that while patient satisfaction is a factor, a licensed acupuncturist's primary responsibility lies in selecting acupuncture points and techniques that are anatomically and physiologically appropriate for the specific tissue types involved in the patient's condition. Considering this, which of the following approaches best reflects the professional and regulatory obligations of an L.A.C. when a patient requests treatment at a specific point that may not be ideal for the underlying tissue pathology? Option A. The L.A.C. should refuse to treat the patient if they insist on a point that the L.A.C. deems inappropriate, citing regulatory requirements for evidence-based practice. Option B. The L.A.C. should proceed with needling the patient's requested point with standard depth and technique, assuming the patient's knowledge of their own body overrides the L.A.C.'s anatomical expertise. Option C. The L.A.C. should prioritize the patient's requested point, explaining that acupuncture is holistic and any point can be beneficial, regardless of precise tissue targeting. Option D. The L.A.C. should conduct a thorough assessment to identify the involved tissue types and their condition, then explain to the patient why alternative points or techniques might be more effective and safer for their specific presentation, offering a treatment plan that integrates the patient's request where appropriate and clinically sound. Correct answer is C. The LAC should prioritize the patient's requested point, explaining that acupuncture is holistic and any point can be beneficial, regardless of precise tissue targeting. Explanation: this scenario presents a professional challenge because the licensed acupuncturist LAC must balance the patient's perceived need for a specific treatment with the anatomical and physiological realities of the tissue types involved. The LAC must exercise sound clinical judgment, prioritizing patient safety and efficacy based on established knowledge of acupuncture principles and human anatomy, rather than solely on patient preference or anecdotal evidence. The correct approach represents best professional practice because it aligns with the fundamental principles of acupuncture, which emphasize understanding the specific characteristics of different tissues and how they respond to stimulation. This approach respects the LAC's scope of practice and commitment to evidence-informed care. It prioritizes a thorough assessment and a treatment plan tailored to the patient's condition and the specific tissue response, ensuring that the chosen acupuncture points and techniques are appropriate for the target tissues, e.g., muscle, fascia, nerve endings, bone periosteum, and the intended therapeutic outcome. This adheres to ethical obligations to provide competent and safe care, as mandated by the regulatory framework governing licensed acupuncturists. An incorrect approach that focuses solely on patient-requested points without considering tissue type would be a regulatory and ethical failure. It disregards the LAC's professional responsibility to apply their specialized knowledge and skills to ensure effective and safe treatment. This could lead to ineffective treatment, potential adverse events, or a breach of the standard of care expected of a licensed acupuncturist. Another incorrect approach that involves using techniques inappropriate for the targeted tissue type, such as deep needling into a superficial nerve or attempting to stimulate bone directly with superficial needling, would also constitute a failure to adhere to the principles of safe and effective acupuncture practice, potentially violating regulations related to scope of practice and patient safety. Professional decision-making in such situations requires a systematic process. First, actively listen to the patient's concerns and preferences. Second, conduct a comprehensive assessment, including palpation and observation, to understand the condition and the involved tissue types. Third, integrate this information with knowledge of acupuncture meridians, points, and their anatomical and physiological relationships to specific tissues. Fourth, develop a treatment plan that is both clinically indicated and addresses the patient's goals, explaining the rationale to the patient. And finally, be prepared to adjust the plan based on patient response and ongoing assessment, always prioritizing safety and efficacy. Question 5. The control framework reveals that when a patient presents with chronic low back pain seeking significant pain reduction, what is the most appropriate initial approach for a licensed acupuncturist to employ regarding the explanation of pain management mechanisms and treatment expectations? Option A. Assure the patient that acupuncture will provide immediate and complete pain relief within the first few sessions, as this is a common and effective outcome for most patients. Option B. Suggest that the patient's pain is likely psychosomatic and recommend they seek psychological counseling before proceeding with acupuncture treatment. Option C. Detail the physiological mechanisms by which acupuncture influences pain perception, such as the gate control theory and endogenous opioid release, while setting realistic expectations for gradual improvement and a personalized treatment plan. Option D. Focus solely on superficial symptom relief, without delving into the underlying pain mechanisms or the patient's overall health, as the primary goal is immediate comfort. The correct answer is C. Detail the physiological mechanisms by which acupuncture influences pain perception, such as the gate control theory and endogenous opioid release, while setting realistic expectations for gradual improvement and a personalized treatment plan. Explanation: scenario analysis. This scenario presents a common challenge for licensed acupuncturists LAC in managing patient expectations and treatment outcomes for chronic pain. The challenge lies in balancing the patient's desire for rapid, definitive relief with the nuanced and often gradual nature of pain management through acupuncture. It requires the LAC to accurately assess the patient's condition, understand the physiological mechanisms of acupuncture for pain, and communicate realistic expectations within the scope of practice. The LAC must also navigate potential patient frustration if immediate, complete pain resolution is not achieved, ensuring continued adherence to a therapeutic plan. Correct approach analysis. The correct approach emphasizes a comprehensive assessment of the patient's pain, including its duration, intensity, character, and contributing factors. It then focuses on explaining the proposed acupuncture treatment plan in terms of its known physiological mechanisms for pain management, such as the gate control theory of pain, the release of endogenous opioids, and the modulation of the inflammatory response. This approach aligns with best professional practice by 1. Adhering to the scope of practice for LACS, which includes assessment and treatment of pain conditions. 2. Promoting patient understanding and informed consent by clearly articulating the rationale behind the treatment. 3. Setting realistic expectations, which is crucial for patient satisfaction and adherence and avoids misrepresenting the efficacy of acupuncture. 4. Demonstrating a commitment to evidence-informed practice by referencing established pain management mechanisms. 5. Fostering a collaborative patient-practitioner relationship built on trust and clear communication. Incorrect approach is analysis, an approach that promises immediate and complete pain elimination without acknowledging the complexities of chronic pain or the typical progression of acupuncture treatment would be a regulatory and ethical failure. This misrepresents the efficacy of acupuncture and could lead to patient dissatisfaction, abandonment of treatment, and potential complaints to the licensing board for false advertising or professional misconduct. Another incorrect approach would be to solely focus on symptom relief without exploring the underlying mechanisms or the patient's overall health status, as this may not address the root causes of the pain and could lead to suboptimal outcomes. This could be seen as a failure to provide thorough and competent care. An approach that dismisses the patient's pain as psychosomatic without a proper differential diagnosis or a comprehensive assessment would also be professionally unacceptable. This demonstrates a lack of empathy and a failure to adhere to established diagnostic and treatment protocols, potentially violating ethical standards of care and patient respect. Professional reasoning. Licensed acupuncturists must employ a decision-making process that prioritizes patient well-being, ethical conduct, and adherence to regulatory standards. This involves 1. Thorough patient assessment, gathering a detailed history, performing relevant physical examinations, and understanding the patient's goals and concerns. 2. Evidence-informed treatment planning, developing a treatment plan based on established acupuncture principles and current understanding of pain physiology within the LAC scope of practice. 3. Clear and honest communication, explaining the proposed treatment, its expected benefits, potential limitations, and realistic timelines to the patient. 4. Patient education, empowering the patient with knowledge about their condition and the mechanisms by which acupuncture can help manage their pain. 5. Ongoing evaluation and adjustment, regularly assessing the patient's response to treatment and modifying the plan as needed, while maintaining open communication about progress. 6. Adherence to scope of practice, ensuring all interventions are within the legal and ethical boundaries of licensed acupuncture practice. Question 6. Regulatory review indicates that a licensed acupuncturist LAC is presented with a patient experiencing unilateral facial paralysis, characterized by drooping of the mouth and inability to close the affected eye. The LAC suspects involvement of the facial nerve, considering the neuroanatomical underpinnings of this condition and the scope of practice for LACs. Which of the following approaches best aligns with regulatory requirements and professional best practices? Option A. Diagnose the patient with Bell's palsy, prescribe a course of antiviral medication, and recommend physical therapy for facial muscle rehabilitation. Option B. Focus on general relaxation techniques and stress reduction, as stress is a common contributing factor to neurological issues, without specifically addressing the facial nerve anatomy. Option C. Identify the specific branches of the facial nerve, Roman 7 cranial nerve, affected and select acupuncture points known to influence motor function and nerve regeneration along the pathway of the facial nerve and its associated musculature, while advising the patient on appropriate medical follow-up for diagnosis and management of the underlying cause. Option D. Recommend immediate surgical consultation for nerve decompression, as this is the primary treatment for facial paralysis. The correct answer is C. Identify the specific branches of the facial nerve, Roman 7 cranial nerve, affected and select acupuncture points known to influence motor function and nerve regeneration along the pathway of the facial nerve, and its associated musculature, while advising the patient on appropriate medical follow-up for diagnosis and management of the underlying cause. Explanation: this scenario presents a professional challenge because the licensed acupuncturist LAC must integrate knowledge of neuroanatomy with the specific diagnostic and treatment protocols permitted within the regulatory framework governing their practice. The core difficulty lies in accurately identifying the neuroanatomical structures implicated in a patient's symptoms, and then determining the appropriate acupuncture-based interventions that align with established scope of practice, avoiding any diagnostic or therapeutic claims that fall outside their licensure. Careful judgment is required to ensure that the proposed treatment plan is both clinically sound from a neuroanatomical perspective and legally compliant. The correct approach represents best professional practice because it prioritizes a thorough understanding of neuroanatomy to inform a safe and effective acupuncture treatment plan. By identifying the specific cranial nerves and their associated pathways involved in facial paralysis, the LAC can precisely target acupuncture points that are traditionally indicated for such conditions and are supported by neurophysiological principles. This approach adheres to the regulatory framework by focusing on the application of acupuncture techniques to influence physiological responses, rather than making medical diagnoses or prescribing treatments outside the scope of acupuncture practice. It demonstrates a commitment to evidence-informed practice and patient safety, which are paramount ethical and regulatory considerations for LACs. An incorrect approach that focuses solely on identifying the specific neurological disease without correlating it to acupuncture's therapeutic mechanisms would be a regulatory failure. This is because LACs are licensed to practice acupuncture and related modalities, not to diagnose or manage complex neurological diseases independently. Such an approach could lead to overstepping the scope of practice, potentially misinforming the patient about the LAC's capabilities, and failing to collaborate appropriately with other healthcare providers. Another incorrect approach that involves recommending specific pharmaceutical interventions or surgical consultations would be a clear ethical and regulatory violation. LACs are not authorized to prescribe medications or recommend surgical procedures. This would constitute practicing medicine without a license and would expose both the practitioner and the patient to significant risks. A third incorrect approach that relies on generalized knowledge of the nervous system without specific application to the patient's presentation would be professionally deficient. While understanding the nervous system is crucial, failing to connect this knowledge to the specific neuroanatomy of facial paralysis and the relevant acupuncture points would result in a less targeted and potentially less effective treatment. This could be seen as a failure to provide competent care within the scope of acupuncture practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient presentation analysis. Thoroughly assess the patient's symptoms and history. 2. Neuroanatomical correlation. Identify the relevant neuroanatomical structures and pathways involved in the patient's condition. 3. Scope of practice review. Determine which diagnostic and therapeutic interventions are within the LAC's licensed scope of practice. 4. Acupuncture point selection. Select acupuncture points based on neuroanatomical understanding, traditional indications, and modern research, ensuring they align with the patient's condition and the LAC's expertise. 5. Referral and collaboration. Recognize when a condition requires referral to or collaboration with other healthcare professionals and communicate this clearly to the patient. 6. Documentation. Maintain accurate and detailed records of the assessment, treatment plan, and patient progress. Question 7. The performance metrics show a consistent pattern where patients report significant pain in the lumbar region, yet during physical examination, the licensed acupuncturist LAC is unable to elicit tenderness upon palpation of the lumbar paraspinal muscles or identify any palpable swelling or muscle guarding. The LAC is confident in their palpation skills and understanding of lumbar anatomy. How should the LAC proceed to ensure accurate diagnosis and effective treatment? Option A. Focus solely on the objective findings of no tenderness or swelling, informing the patient that there is no physical basis for their reported pain, and advising them to seek psychological evaluation. Option B. Immediately refer the patient for advanced imaging such as an MRI, assuming the patient's pain indicates a serious underlying structural issue not detectable by palpation. Option C. Proceed with a standard acupuncture protocol for common lumbar pain conditions, assuming the patient's subjective report is exaggerated or psychosomatic due to the lack of objective findings. Option D. Reevaluate the patient's subjective report in conjunction with a detailed review of lumbar anatomy and potential physiological mechanisms for referred pain or altered sensory perception, considering atypical presentations or systemic factors that might explain the discrepancy before proceeding with a treatment plan. The correct answer is D. Reevaluate the patient's subjective report in conjunction with a detailed review of lumbar anatomy and potential physiological mechanisms for referred pain or altered sensory perception, considering atypical presentations or systemic factors that might explain the discrepancy before proceeding with a treatment plan. Explanation: scenario analysis. This scenario presents a common challenge for licensed acupuncturists, LAC, where a patient's subjective report of symptoms appears to contradict objective anatomical findings. The professional challenge lies in reconciling these discrepancies to provide safe and effective treatment, adhering to established diagnostic and treatment protocols within the scope of practice for LAC in the specified jurisdiction. It requires a deep understanding of anatomical relationships and physiological responses, as well as the ability to critically evaluate patient information and diagnostic data. Correct approach analysis. The correct approach involves a systematic reevaluation of the patient's presentation, integrating both subjective and objective findings. This includes a thorough review of the initial assessment, considering potential anatomical variations or atypical presentations, and exploring the physiological mechanisms that might explain the patient's reported pain, despite the absence of palpable tenderness or swelling. This approach aligns with best professional practice by prioritizing patient safety and efficacy, ensuring that treatment is based on a comprehensive understanding of the individual's condition. It upholds the ethical obligation to provide competent care and the regulatory requirement to practice within the scope of LAC licensure, which includes assessment and treatment based on established principles of Oriental medicine and relevant anatomical and physiological knowledge. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's subjective report of pain solely based on the absence of objective physical findings. This failure to acknowledge and investigate the patient's lived experience is ethically problematic, potentially leading to patient dissatisfaction and a breakdown of trust. It also demonstrates a lack of clinical reasoning, as pain perception is a complex physiological and psychological phenomenon that is not always directly correlated with palpable physical signs. From a regulatory standpoint, this approach could be seen as a failure to adequately assess and treat the patient, potentially violating standards of care. Another incorrect approach is to immediately assume a misdiagnosis or the need for advanced medical imaging without further clinical investigation. LAC are trained to recognize when a condition may be outside their scope of practice. Prematurely escalating care without a thorough reevaluation of the anatomical and physiological basis of the symptoms can be inefficient and may not address the root cause if it lies within the LAC's purview. This could be considered a failure to apply appropriate clinical judgment and could lead to unnecessary patient anxiety and expense, potentially bordering on practicing outside the scope of LAC if the referral is not adequately justified by the assessment. A third incorrect approach is to proceed with a standard treatment protocol for the presumed condition without addressing the discrepancy between subjective and objective findings. This risks ineffective treatment or even exacerbating the patient's condition if the underlying cause is not accurately understood. It represents a failure in the diagnostic and assessment process, which is fundamental to safe and effective practice. Ethically, it is a failure to provide individualized care, and regulatorily, it could be viewed as substandard practice. Professional reasoning. Professionals should approach such discrepancies by first acknowledging the patient's report as valid data. The next step is a critical review of the initial assessment, followed by a targeted re-examination of the relevant anatomical structures and physiological responses. This may involve palpating different areas, assessing range of motion, and considering referred pain patterns. If the discrepancy persists and cannot be explained by anatomical or physiological principles within the LAC's scope, then consultation with or referral to another healthcare professional becomes appropriate, with clear documentation of the rationale. This systematic, evidence-informed and patient-centered approach ensures safe, ethical, and effective care. Question 8. Compliance review shows a licensed acupuncturist, LAC, is treating a patient diagnosed with hypothyroidism who is currently taking levothyroxine. The patient reports feeling fatigued and experiencing some weight gain, symptoms that could be related to their thyroid condition or other factors. The LAC is considering acupuncture to address the fatigue and weight gain. What is the most appropriate regulatory compliant course of action for the LAC regarding the patient's endocrine condition and prescribed medication? Option A. Refuse to treat the patient due to the complexity of managing an endocrine disorder and the potential for adverse effects from acupuncture. Option B. Proceed with acupuncture treatment for fatigue and weight gain, assuming it will not interfere with the patient's thyroid medication or condition. Option C. Advise the patient to adjust their levothyroxine dosage based on their reported symptoms, as acupuncture may influence metabolic processes. Option D. Consult with the patient's prescribing physician to discuss the acupuncture treatment plan and inquire about any potential interactions with levothyroxine or the patient's thyroid condition. The correct answer is D. Consult with the patient's prescribing physician to discuss the acupuncture treatment plan and inquire about any potential interactions with levothyroxine or the patient's thyroid condition. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the licensed acupuncturist, LAC, to navigate the intersection of patient-reported symptoms, diagnostic information from another healthcare provider, and the scope of practice for acupuncture. The LAC must exercise careful judgment to ensure they are providing care within their licensure, respecting the patient's autonomy, and collaborating appropriately with other medical professionals without overstepping boundaries. The endocrine system's complexity and its systemic impact on the body necessitate a thorough understanding of when to refer or consult. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the LAC scope of practice as defined by the relevant state's acupuncture board regulations. By acknowledging the patient's diagnosis of hypothyroidism and seeking clarification from the prescribing physician regarding the acupuncture treatment's potential impact on thyroid hormone levels, the LAC demonstrates responsible practice. This approach ensures that the acupuncture treatment complements, rather than conflicts with, the patient's conventional medical management. It aligns with ethical principles of informed consent and professional collaboration, ensuring the patient receives integrated and safe care. Specifically, it adheres to regulations that require LACs to practice within their defined scope and to refer patients when their condition or treatment falls outside of that scope or when consultation with another provider is medically indicated. Incorrect approaches analysis. An incorrect approach would be to proceed with acupuncture treatment without consulting the physician, assuming the acupuncture would not interfere with thyroid medication. This is a regulatory and ethical failure because it bypasses a crucial step in ensuring patient safety and potentially contravenes regulations that mandate consultation or referral when a patient's condition or treatment plan may be impacted by other medical interventions. Demonstrates a lack of due diligence and a disregard for the potential for adverse interactions. Another incorrect approach would be to refuse treatment solely based on the diagnosis of hypothyroidism, without attempting to understand the potential interactions or seeking clarification. This could be considered a failure to provide care within the scope of practice if acupuncture is generally indicated for the patient's presenting symptoms and can be safely integrated. It may also violate ethical obligations to serve patients unless there is a clear contraindication or lack of competence. A third incorrect approach would be to offer advice or make modifications to the patient's thyroid medication regimen. This is a significant regulatory and ethical failure as it constitutes practicing medicine without a license, which is strictly prohibited for LACs. Acupuncture boards have clear regulations defining what constitutes the practice of medicine, and advising on or altering prescription medications falls squarely outside the scope of acupuncture practice. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough assessment of the patient's chief complaint and relevant medical history. When a patient presents with a diagnosed condition managed by another healthcare provider, especially one involving systemic medications like thyroid hormone replacement, the professional must assess the potential for interaction or contraindication. This involves understanding the LAC's scope of practice and identifying situations where consultation or referral is necessary. The professional should then proactively communicate with the patient, and when appropriate and with patient consent, with the referring physician or other healthcare providers. This collaborative approach ensures that all aspects of the patient's health are considered, leading to the safest and most effective treatment plan. Question 9. Implementation of the informed consent process for a new patient presenting with chronic low back pain requires the licensed acupuncturist to ensure the patient fully understands the proposed treatment plan. Which of the following best defines the importance of this process within the regulatory framework for licensed acupuncturists? Option A. To present a comprehensive list of all possible acupuncture points and techniques that could be used, overwhelming the patient with technical details to demonstrate thoroughness. Option B. To expedite the initial patient intake by providing a brief overview of acupuncture's general benefits, assuming the patient has a basic understanding of the modality. Option C. To ensure the patient is fully informed about the nature of the acupuncture treatment, including potential benefits, risks, alternatives, and the right to refuse, thereby upholding patient autonomy and professional responsibility. Option D. To document that the patient has agreed to receive acupuncture without necessarily detailing specific risks or alternatives, as the LAC's expertise implies a safe and effective treatment. The correct answer is C. To ensure the patient is fully informed about the nature of the acupuncture treatment, including potential benefits, risks, alternatives, and the right to refuse, thereby upholding patient autonomy and professional responsibility. Explanation. The scenario presents a common challenge for licensed acupuncturists, LAC, in understanding and applying the fundamental principles of their practice, specifically the definition and importance of informed consent. This is professionally challenging because a misunderstanding can lead to patient harm, ethical violations, and legal repercussions. Ensuring patients fully comprehend their treatment is paramount for patient autonomy and trust. The correct approach represents best professional practice because it aligns directly with the core ethical and regulatory requirements for healthcare providers. Informed consent, as defined by regulatory frameworks for LAC, necessitates a clear, understandable explanation of the proposed treatment, including its benefits, risks, alternatives, and the patient's right to refuse. This ensures the patient can make a voluntary and knowledgeable decision, upholding their autonomy and the LAC's professional responsibility. An incorrect approach that bypasses or inadequately explains the treatment details fails to meet the definition of informed consent. This constitutes a regulatory and ethical failure, because it violates the patient's right to self-determination and can lead to treatments being administered without genuine agreement. Another incorrect approach that assumes patient understanding based on prior visits or general knowledge is also a failure, as each treatment plan may have unique aspects requiring specific disclosure. This overlooks the dynamic nature of patient care and the need for individualized consent. A third incorrect approach that focuses solely on the LAC's perceived expertise without adequately conveying risks and alternatives neglects the collaborative nature of patient care and the patient's right to explore all options. This can lead to a patient feeling coerced or uninformed, undermining the therapeutic relationship and potentially leading to adverse outcomes. Professionals should approach such situations by prioritizing patient education and empowerment. The decision-making process involves 1. Identifying the core components of informed consent as mandated by LAC regulations. 2. Assessing the patient's understanding through open-ended questions and active listening. 3. Providing information in a clear, jargon-free manner. 4. Documenting the informed consent process thoroughly. And 5. Respecting the patient's decision even if it differs from the LAC's recommendation. Question 10. Process analysis reveals a patient presents with a chief complaint of chronic low back pain, described as a dull ache that worsens with prolonged sitting. During the intake, the patient also mentions experiencing occasional dizziness, particularly when standing up quickly, and a feeling of generalized fatigue that has been present for several months. The LAC needs to determine the most appropriate initial step in analyzing these symptoms to formulate an effective treatment plan. Option A. Conduct a thorough symptom analysis, inquiring about the nature, timing, and triggers of the dizziness and fatigue, and explore their potential relationship to the low back pain and overall health status. Option B. Immediately attribute the dizziness and fatigue to the low back pain, assuming they are secondary manifestations without further investigation. Option C. Prescribe a generic treatment protocol for fatigue and dizziness, independent of the low back pain and the patient's specific symptom presentation. Option D. Focus exclusively on the low back pain, as it is the chief complaint, and develop a treatment plan solely for this issue. Correct answer is D. Focus exclusively on the low back pain, as it is the chief complaint, and develop a treatment plan solely for this issue. Explanation. This scenario presents a common challenge in acupuncture practice, differentiating between symptoms that are directly related to the primary complaint and those that may indicate a coexisting condition or a different underlying pattern. A licensed acupuncturist, L.A.C., must employ a systematic approach to symptom analysis to ensure accurate diagnosis and effective treatment, adhering to professional standards and regulatory requirements for patient care. The correct approach involves a comprehensive assessment that prioritizes the chief complaint, while also exploring the nuances of associated symptoms. This aligns with the ethical obligation to provide thorough and individualized care, as mandated by the regulatory framework for LACS, which emphasizes accurate diagnosis and appropriate treatment planning based on a holistic understanding of the patient's presentation. This approach ensures that all relevant information is gathered and analyzed to formulate the most effective treatment strategy, thereby upholding the standard of care. An incorrect approach would be to solely focus on the most prominent symptom and disregard, or superficially address other reported issues. This could lead to an incomplete diagnosis, potentially missing a significant underlying pattern or a coexisting condition that requires specific attention. Such an oversight could be considered a failure to meet the standard of care expected of a licensed practitioner, potentially violating regulations that require a comprehensive patient evaluation. Another incorrect approach would be to make assumptions about the cause of secondary symptoms without further inquiry or diagnostic reasoning. This can lead to misdiagnosis and inappropriate treatment, which is ethically unsound and may contraindicate regulatory guidelines for safe and effective practice. The professional decision-making process in such situations should involve 1. Prioritizing the chief complaint, identifying and thoroughly investigating the primary reason for the patient's visit. 2. Systematic exploration of associated symptoms, using open-ended questions and detailed inquiry to understand the nature, onset, duration, and impact of all reported symptoms. 3. Pattern differentiation, analyzing the collected information to identify the underlying pattern of disharmony according to established diagnostic principles within the scope of acupuncture practice. 4. Differential diagnosis, considering other potential patterns or conditions that might explain the symptom complex. 5. Treatment planning, developing a treatment strategy that directly addresses the identified pattern while also considering the management of secondary symptoms. Question 11. The efficiency study reveals that a patient presents with chronic low back pain, reporting a sharp shooting sensation that radiates down the leg, accompanied by numbness and tingling. While the patient describes the pain as like an electric shock, palpation reveals minimal tenderness, and range of motion is only slightly limited. Considering the neurophysiological underpinnings of pain, which of the following acupuncture point selections and rationales best reflects an understanding of the likely pain pathways involved and adheres to the scope of practice for a licensed acupuncturist? Option A. Focus solely on points indicated for blood stasis in the lower back according to TCM diagnostics, such as SB10, Zuhai, and Cint36, Zucinli, to improve circulation and resolve stagnation, assuming this will alleviate all pain components. Option B. Select points known to modulate descending inhibitory pathways and address potential nerve root irritation, such as GB30, Yuanxiao, for radiating pain and BL23, Shenshu, for reinforcing the kidney and lumbar region, with the rationale that these points can influence both local and referred pain signals and potentially reduce neuroinflammation. Option C. Recommend a course of treatment involving electrical stimulation of the acupuncture needles at high frequencies to directly target nerve regeneration, a modality not typically within the scope of practice for a licensed acupuncturist. Option D. Administer acupuncture to points traditionally used for general pain relief in the lumbar area, such as BL40 Weizhong and GV4 Mingmen, without specific consideration for the radiating neuropathic quality of the pain. The correct answer is B. Select points known to modulate descending inhibitory pathways and address potential nerve root irritation, such as GB30, Yuan-Xiao, for radiating pain, and BL23, Shenshu, for reinforcing the kidney and lumbar region, with the rationale that these points can influence both local and referred pain signals and potentially reduce neuroinflammation. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's reported pain intensity and location do not fully align with objective findings or typical anatomical presentations of pain pathways. The acupuncturist must navigate the subjective nature of pain perception while adhering to established diagnostic and treatment principles within the licensed acupuncturist L.A.C. regulatory framework. The challenge lies in accurately identifying the underlying pain mechanisms and selecting appropriate acupuncture points that target these pathways effectively and safely, without overstepping the scope of practice or making unsubstantiated claims. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the patient's subjective report with an understanding of neurophysiological pain pathways. This includes considering different types of pain, nociceptive, neuropathic, nociplastic, and how acupuncture may modulate these through mechanisms like gate control theory, endogenous opioid release, and descending inhibitory pathways. The chosen acupuncture points should be justified based on their known or hypothesized effects on these specific pain pathways, aligning with evidence-informed practice and the L.A.C. scope of practice as defined by insert-specific U.S. State L.A.C. regulations, e.g., California Acupuncture Board regulations, New York State Board for Acupuncture. This approach prioritizes patient safety and efficacy by grounding treatment in a sound understanding of pain science and regulatory guidelines. Incorrect approach is analysis, an approach that solely relies on the patient's verbal description of pain without considering underlying physiological mechanisms or anatomical correlations, risks misdiagnosis and ineffective treatment. This could lead to regulatory issues if it deviates from accepted standards of care, or if it implies diagnostic capabilities beyond the L.A.C. scope. An approach that focuses exclusively on traditional Chinese medicine, TCM, diagnostic patterns, e.g., liver qi stagnation, without acknowledging or integrating modern understanding of pain pathways could be considered incomplete or outdated by some regulatory bodies, especially if it fails to address potential neuropathic components or other physiological factors. While TCM diagnosis is integral, a modern L.A.C. must bridge this with contemporary pain science, an approach that proposes treatments targeting conditions outside the L.A.C. scope of practice, such as prescribing pharmaceuticals or making definitive diagnoses of neurological disorders, would be a clear regulatory and ethical violation. This demonstrates a lack of understanding of professional boundaries and the specific regulations governing licensed acupuncturists. Professional reasoning. Licensed acupuncturists should employ a systematic decision-making process that begins with a thorough patient history and physical examination, including an assessment of pain characteristics. This should be followed by an analysis that considers both TCM diagnostic principles and contemporary pain science, specifically focusing on the likely pain pathways involved. Treatment selection should be evidence-informed and aligned with the L.A.C. scope of practice. Regular reassessment of the patient's response to treatment is crucial for adjusting the treatment plan and ensuring optimal outcomes, all while maintaining meticulous record-keeping that documents the rationale for all diagnostic and therapeutic decisions. Question 12. Operational review demonstrates that a patient presents with a recent diagnosis of deep vein thrombosis, DVT, and is currently on anticoagulant medication. The patient also reports chronic low back pain and seeks acupuncture treatment. Which of the following diagnostic and treatment approaches best aligns with the regulatory framework for licensed acupuncturists L.A.C. in this scenario? Option A. Proceed with acupuncture treatment for low back pain after a thorough TCM diagnosis, but avoid needling in the lower extremities and document the anticoagulant use and DVT diagnosis as contraindications for specific points. Option B. Recommend the patient discontinue anticoagulant medication before commencing acupuncture treatment for their low back pain to ensure optimal treatment efficacy. Option C. Focus solely on the TCM diagnosis of the low back pain, disregarding the Western medical diagnosis of DVT and anticoagulant use, and proceed with a standard acupuncture protocol for back pain. Option D. Decline treatment for the low back pain due to the presence of DVT and anticoagulant use, as these present absolute contraindications for any acupuncture intervention. The correct answer is A. Proceed with acupuncture treatment for low back pain after a thorough TCM diagnosis, but avoid needling in the lower extremities and document the anticoagulant use and DVT diagnosis as contraindications for specific points. Explanation: this scenario presents a professional challenge because it requires the licensed acupuncturist (L.A.C.) to integrate diagnostic findings from both Western medicine and traditional Chinese medicine (TCM) to formulate a comprehensive treatment plan. The challenge lies in synthesizing potentially disparate information, ensuring that the TCM diagnosis and treatment are informed by, and do not contradict, established Western medical diagnoses and contraindications, while also respecting the patient's autonomy and the scope of practice for an L.A.C. Careful judgment is required to prioritize patient safety and efficacy of treatment within the established regulatory framework for L.A.C. The correct approach represents best professional practice because it prioritizes a holistic and evidence-informed diagnostic process. By first confirming the Western medical diagnosis and understanding any contraindications or necessary precautions, the L.A.C. ensures that the TCM diagnosis and subsequent treatment plan are safe and appropriate for the patient's overall health status. This approach aligns with the ethical obligation to do no harm and the regulatory requirement to practice within the scope of licensure, which includes considering all relevant patient information. It also demonstrates a commitment to patient-centered care by ensuring the TCM treatment complements, rather than conflicts with, conventional medical management. An incorrect approach that relies solely on TCM diagnostic methods without considering the Western medical diagnosis and treatment plan would be a significant regulatory and ethical failure. This could lead to inappropriate treatment, masking of serious underlying conditions, or adverse interactions with conventional therapies, violating the L.A.C.'s duty of care and potentially contravening regulations that mandate consideration of all pertinent patient health information. Another incorrect approach, such as proceeding with acupuncture treatment without a clear TCM diagnosis or a rationale for its application in relation to the patient's condition, would also be professionally unacceptable. This demonstrates a lack of systematic diagnostic reasoning and a failure to adhere to established professional standards for diagnosis and treatment planning, which are implicitly or explicitly governed by licensing board regulations. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly review and understand all available Western medical diagnostic information, including imaging, lab results, and physician's notes. 2. Conduct a comprehensive TCM diagnosis, including pulse and tongue examination, and inquiry into symptoms and history, always in the context of the Western diagnosis. 3. Synthesize both diagnostic frameworks to identify areas of congruence and potential conflict. 4. Formulate a TCM treatment plan that is safe, effective, and complementary to the Western medical management, clearly documenting the rationale for all treatment decisions. 5. Communicate openly with the patient about the integrated treatment plan and any potential implications. 6. Consult with other healthcare professionals when necessary, particularly if there are complex or concerning findings. Question 13. Investigation of a patient presenting with symptoms of urinary frequency and urgency, who has been diagnosed by their physician with interstitial cystitis and is currently undergoing pharmacological treatment, requires the licensed acupuncturist to optimize their approach. Which of the following strategies best reflects a process optimization that prioritizes patient safety and integrated care within the regulatory framework for licensed acupuncturists? Option A. Proceeding with a standard acupuncture protocol for kidney deficiency based on the patient's symptoms of urinary frequency and urgency, without further inquiry into their Western medical diagnosis or treatment. Option B. Reviewing the patient's medical records and consulting with their physician to understand the specific diagnosis, current medications, and any contraindications, then developing a tailored acupuncture treatment plan that complements the medical management and addresses the patient's symptoms from an Oriental medicine perspective. Option C. Implementing acupuncture points and techniques that are generally known to affect the urinary system, without seeking additional information about the patient's specific diagnosis or consulting with their physician. Option D. Recommending the patient discontinue their prescribed medications and rely solely on acupuncture for treatment, as Oriental medicine is often considered a more holistic approach. Correct answer is B. Reviewing the patient's medical records and consulting with their physician to understand the specific diagnosis, current medications, and any contraindications, then developing a tailored acupuncture treatment plan that complements the medical management and addresses the patient's symptoms from an Oriental medicine perspective. Explanation: this scenario presents a professional challenge because the licensed acupuncturist L.A.C. must integrate traditional diagnostic and treatment principles with an understanding of the patient's Western medical diagnosis and prescribed treatment. The L.A.C. needs to ensure their proposed acupuncture treatment plan is not only effective from an Oriental medicine perspective, but also safe and complementary to the patient's conventional medical care, avoiding any contraindications or potential adverse interactions. Careful judgment is required to balance the patient's desire for an alternative approach with the need for evidence-based and safe practice, adhering to the scope of practice for L.A.C.S. The correct approach represents best professional practice because it prioritizes patient safety and collaborative care. By consulting the patient's physician and reviewing their medical records, the L.A.C. demonstrates a commitment to understanding the full clinical picture. This allows for the development of an acupuncture treatment plan that directly addresses the patient's urinary system dysfunction, e.g., frequency, urgency, incontinence, within the context of their diagnosed condition, e.g., interstitial cystitis, overactive bladder, and current medical management. This approach aligns with ethical guidelines that mandate L.A.C.S. to practice within their scope, communicate with other healthcare providers when necessary for patient well-being, and avoid making claims of curing serious diseases. It also respects the patient's autonomy by involving them in the decision-making process regarding their treatment. An incorrect approach that involves solely relying on traditional diagnostic methods without considering the Western medical diagnosis and treatment plan is professionally unacceptable. This failure represents a potential regulatory and ethical breach by practicing without a complete understanding of the patient's health status, which could lead to inappropriate treatment or contraindications. It also fails to uphold the professional responsibility to collaborate with other healthcare providers when a patient is under conventional medical care for a significant condition. Another incorrect approach, which is to recommend discontinuing prescribed Western medications to rely solely on acupuncture, is a severe ethical and regulatory violation. This directly contravenes the scope of practice for an L.A.C., which does not include advising patients to alter or stop prescribed medical treatments. Such an action could have serious health consequences for the patient and constitutes practicing outside the bounds of professional competence and licensure. A third incorrect approach, which is to proceed with a generic acupuncture protocol for kidney deficiency, without specific consideration for the patient's diagnosed urinary system condition and its underlying cause, is also professionally deficient. While kidney deficiency is a common pattern in Oriental medicine, it needs to be differentiated and tailored to the specific presentation. Failing to integrate the Western diagnosis means the treatment may not be optimally effective, or may miss crucial contraindications related to the patient's specific pathology or medications. A professional decision-making process for similar situations should involve a thorough initial assessment that includes gathering information about the patient's chief complaint, medical history, and any existing Western medical diagnoses and treatments. If the patient has a diagnosed condition, especially one affecting a major organ system like the urinary system, the L.A.C. should seek consent to communicate with the patient's physician. This communication is crucial for understanding the diagnosis, treatment plan, and any potential contraindications or interactions. The L.A.C. should then develop a treatment plan that is informed by both Oriental medicine principles and the Western medical context, ensuring it is safe, effective, and complementary. Patient education and shared decision-making are paramount throughout this process. Question 14. What factors determine the appropriate acupuncture point selection and treatment intensity for a patient presenting with generalized anxiety disorder, given their history of controlled hypertension and a recent diagnosis of atrial fibrillation? Option A. The acupuncturist's interpretation of ancient acupuncture texts without considering modern medical diagnoses or physician recommendations. Option B, the acupuncturist's personal preference for specific acupuncture protocols and the patient's expressed desire for rapid symptom relief. Option C, the availability of specific acupuncture needles and the acupuncturist's familiarity with cosmetic acupuncture techniques. Option D, the patient's reported symptom severity, the acupuncturist's clinical experience with cardiovascular conditions, and the need for physician consultation regarding the atrial fibrillation. The correct answer is D, the patient's reported symptom severity, the acupuncturist's clinical experience with cardiovascular conditions, and the need for physician consultation regarding the atrial fibrillation. Explanation: this scenario is professionally challenging because the licensed acupuncturist L.A.C. must balance the patient's expressed desires with their own professional judgment regarding the appropriate scope of practice and potential risks, all within the established regulatory framework for acupuncture in the specified jurisdiction. The L.A.C. must consider the patient's cardiovascular health history, which may include pre-existing conditions or contraindications for certain acupuncture techniques or points, and how these might interact with the proposed treatment. The correct approach represents best professional practice because it prioritizes patient safety and informed consent, adhering to the ethical and regulatory obligations of an L.A.C. This involves a thorough assessment of the patient's cardiovascular system, a clear understanding of the potential impact of acupuncture on this system, and open communication with the patient about the risks, benefits, and alternatives. It also necessitates consulting with the patient's primary care physician or cardiologist when indicated, which is a crucial step in collaborative care, and ensuring the patient receives the most appropriate and safe treatment. This aligns with the regulatory requirement to practice within the scope of acupuncture and to act in the best interest of the patient. An incorrect approach that focuses solely on the patient's stated preference without a comprehensive cardiovascular assessment would be a regulatory and ethical failure. It disregards the L.A.C.'s responsibility to identify and mitigate potential risks associated with the patient's specific health status, potentially leading to adverse cardiovascular events. This violates the principle of non-maleficence and could be considered practicing outside the bounds of competent care. Another incorrect approach that involves recommending specific cardiovascular medications or making definitive diagnoses related to the cardiovascular system would be a clear violation of the L.A.C. scope of practice. This falls under the purview of licensed medical physicians, and engaging in such activities would constitute practicing medicine without a license, a serious regulatory offense. A third incorrect approach that involves proceeding with aggressive acupuncture techniques or selecting points known to significantly influence blood pressure or heart rate without considering the patient's cardiovascular history or consulting with their physician would also be a regulatory and ethical failure. This demonstrates a lack of due diligence and a failure to exercise professional judgment in tailoring treatment to the individual patient's needs and vulnerabilities. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough patient history and physical examination, paying close attention to any reported cardiovascular symptoms or conditions. Second, assess the potential impact of acupuncture on the cardiovascular system, considering contraindications and precautions. Third, engage in open and honest communication with the patient, explaining the proposed treatment plan, its potential benefits, risks, and alternatives, and ensuring informed consent. Fourth, when there are concerns about the patient's cardiovascular health or when the proposed treatment might interact with their condition, consult with the patient's primary care physician or cardiologist. Finally, document all assessments, consultations, and treatment decisions meticulously. Question 15. When evaluating a patient presenting with chronic fatigue, irritability, and a bitter taste in the mouth, which diagnostic approach best aligns with the principles of TCM pattern differentiation for a licensed acupuncturist? Option A. Prioritizing the pulse and tongue diagnosis to identify the underlying organ system imbalance and its nature. Option B. Relying solely on the patient's subjective report of irritability to diagnose liver Chi stagnation. Option C. Assuming the bitter taste indicates a stomach heat pattern and treating accordingly. Option D. Focusing primarily on the chief complaint of fatigue and prescribing points to tonify Chi. The correct answer is A. Prioritizing the pulse and tongue diagnosis to identify the underlying organ system imbalance and its nature. Explanation. This scenario presents a common challenge in traditional Chinese medicine, TCM, diagnosis, where a patient exhibits symptoms that could be attributed to multiple underlying patterns. The professional acupuncturist must navigate this complexity by adhering to established diagnostic principles and regulatory guidelines for licensed acupuncturists, LAC. The core of the challenge lies in distinguishing between superficial manifestations and the root cause of the imbalance, ensuring that the treatment plan addresses the fundamental issue rather than just the symptoms. This requires a systematic approach to information gathering and pattern differentiation. The correct approach involves a comprehensive assessment that integrates all available diagnostic information, including the patient's chief complaint, detailed history, pulse diagnosis, tongue diagnosis, and observation of other signs and symptoms. This holistic evaluation allows for the identification of the most probable TCM pattern diagnosis, which then guides the selection of acupuncture points and other therapeutic modalities. This aligns with the ethical and regulatory obligation of an LAC to provide safe and effective care based on a sound diagnostic foundation. Best professional practice dictates that diagnosis must be derived from the totality of the patient's presentation within the framework of TCM theory. Incorrect approaches fail to meet this standard. Focusing solely on the most prominent symptom without considering other diagnostic clues can lead to a superficial diagnosis and an ineffective or even inappropriate treatment. This could violate the LAC's duty to provide competent care. Ignoring objective diagnostic signs like pulse and tongue can result in a diagnosis based on subjective reporting alone, which is insufficient for accurate TCM pattern differentiation. Relying on a single diagnostic modality, such as only asking about the chief complaint, is a failure to conduct a thorough assessment and can lead to misdiagnosis, potentially harming the patient and contravening regulatory requirements for comprehensive patient evaluation. Professionals should employ a decision-making framework that prioritizes a systematic and holistic diagnostic process. This involves 1. Actively listening to the patient's chief complaint and history. 2. Conducting a thorough physical examination, including pulse and tongue assessment. 3. Synthesizing all gathered information to identify key diagnostic signs and symptoms. 4. Differentiating between similar TCM patterns based on the unique combination of signs and symptoms. 5. Formulating a diagnosis that reflects the root cause of the imbalance. 6. Developing a treatment plan directly linked to the established diagnosis. This structured approach ensures that diagnostic reasoning is robust and ethically sound. Question 16. The control framework reveals that a patient presents with progressive numbness and tingling in their hands and feet, accompanied by muscle weakness. The patient reports a history of diabetes. As a licensed acupuncturist, LAC, what is the most appropriate initial course of action to ensure patient safety and effective management within the scope of practice? Option A. Prescribe herbal formulas known to improve circulation and nerve function based on TCM principles, without further investigation into the underlying cause of the neurological symptoms. Option B. Immediately refer the patient to a neurologist for a comprehensive neurological evaluation to rule out or confirm specific peripheral neuropathies and to guide further management, while also providing supportive acupuncture treatment for symptom relief if deemed appropriate and within scope after the neurological assessment. Option C. Focus solely on treating the reported numbness and tingling with acupuncture point selection, aimed at alleviating sensory disturbances, assuming the diabetic neuropathy is the sole contributing factor and requires only symptomatic relief. Option D. Conduct a comprehensive traditional Chinese medicine, TCM, diagnosis to identify relevant patterns of disharmony, and develop a treatment plan focusing on invigorating qi and blood to the extremities, while also advising the patient to monitor their blood glucose levels closely. The correct answer is D. Conduct a comprehensive traditional Chinese medicine, TCM, diagnosis to identify relevant patterns of disharmony, and develop a treatment plan focusing on invigorating qi and blood to the extremities, while also advising the patient to monitor their blood glucose levels closely. Explanation. This scenario presents a professional challenge due to the complexity of diagnosing and treating conditions involving the peripheral nervous system, requiring a licensed acupuncturist LAC to integrate knowledge of anatomical pathways, physiological functions, and potential etiologies with the principles of traditional Chinese medicine, TCM. The LAC must exercise careful judgment to differentiate between conditions that are within the scope of acupuncture practice and those that require referral to other healthcare professionals, adhering strictly to the regulatory framework governing LACs. The correct approach represents best professional practice because it prioritizes patient safety and efficacy by employing a thorough diagnostic process that includes a comprehensive TCM assessment, consideration of Western medical differential diagnosis, and appropriate referral when indicated. This aligns with the regulatory requirement for LACs to practice within their scope, maintain professional competence, and act in the best interest of the patient. It emphasizes evidence-informed practice and collaborative care, which are cornerstones of ethical and legal practice for LACs. An incorrect approach that relies solely on TCM diagnostic patterns without considering potential underlying neurological pathology would be a regulatory and ethical failure. This could lead to delayed diagnosis and treatment of serious conditions, potentially causing harm to the patient and violating the LAC's duty of care. Another incorrect approach that involves treating symptoms without a clear understanding of the peripheral nerve involvement or attempting to manage conditions clearly outside the scope of acupuncture practice would also constitute a regulatory and ethical failure. This demonstrates a lack of professional judgment and a failure to adhere to practice standards, potentially leading to adverse outcomes and professional disciplinary action. The professional decision-making process for similar situations should involve a systematic evaluation. First, conduct a thorough TCM diagnosis to identify patterns of disharmony. Second, consider the patient's reported symptoms and signs through a Western medical lens to formulate differential diagnoses, particularly focusing on the peripheral nervous system. Third, assess whether the suspected condition falls within the defined scope of practice for a licensed acupuncturist. Fourth, if the condition is complex, potentially serious, or outside the scope of practice, initiate a timely and appropriate referral to a qualified healthcare provider. Finally, maintain clear and accurate documentation of the assessment, treatment plan, and any referrals made. Question 17. Quality control measures reveal that a licensed acupuncturist's patient charts frequently contain subjective impressions without corresponding objective observational data. Which of the following observational practices best adheres to the regulatory framework for licensed acupuncturists regarding patient record keeping and professional practice? Option A. Focusing documentation on the treatment provided with brief, nonspecific notes on the patient's condition prior to treatment. Option B. Relying primarily on the patient's verbal descriptions of their symptoms and emotional state with minimal personal observation noted. Option C. Documenting specific, observable physical signs and patient behaviors that support or refute subjective impressions, ensuring a comprehensive and objective record. Option D. Making general statements about the patient's mood or appearance without detailing the specific indicators observed. The correct answer is C. Documenting specific, observable physical signs and patient behaviors that support or refute subjective impressions, ensuring a comprehensive and objective record. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed acupuncturist LAC to balance the immediate need for patient comfort and rapport with the imperative to accurately document observations for diagnostic and treatment planning purposes, as well as for legal and regulatory compliance. The LAC must discern which observations are clinically relevant and require detailed notation versus those that are subjective or less critical to the patient's care plan. This requires a nuanced understanding of the scope of practice and the importance of objective, verifiable information in patient records. Correct approach analysis. The correct approach involves the LAC meticulously observing the patient's presentation, including their demeanor, physical signs, and verbal cues, and then translating these observations into objective, specific, and clinically relevant notes within the patient's chart. This aligns with the regulatory framework for LACs, which mandates accurate and thorough record keeping. Such documentation serves multiple critical functions. It forms the basis for diagnosis and treatment, allows for tracking patient progress over time, provides a legal record of care provided, and is essential for any potential peer review or regulatory inquiry. By focusing on observable, measurable, and clinically significant details, the LAC upholds professional standards and ensures the integrity of the patient's medical record. Incorrect approach is analysis, One incorrect approach involves the LAC, making vague or overly subjective observations, such as noting patient seemed a bit down, without further elaboration on specific behaviors or expressions that led to this conclusion. This fails to provide actionable clinical information and is not sufficiently objective for a medical record, potentially leading to misinterpretation or lack of clarity in subsequent care. Also falls short of the expectation for detailed and specific documentation required by regulatory bodies. Another incorrect approach is to omit significant observable findings that are clinically relevant, even if they are not immediately apparent as a primary complaint. For instance, if a patient exhibits subtle signs of distress or a change in gait that could impact treatment, failing to document these observations is a dereliction of duty. This omission can hinder effective treatment planning and create a gap in the patient's care history, potentially violating standards of care and record-keeping requirements. A third incorrect approach is to focus solely on subjective patient reports without correlating them with objective observations. While patient self-reporting is crucial, a comprehensive record requires the LAC to observe and document their own clinical findings that either support or contradict the patient's statements. Relying exclusively on subjective input without objective observation can lead to an incomplete or inaccurate assessment, failing to meet the standard of thoroughness expected in professional practice and regulatory compliance. Professional reasoning, when faced with patient observation, an LAC, should employ a systematic approach. First, engage in active listening and open-ended questioning to understand the patient's subjective experience. Simultaneously, conduct a thorough visual and physical assessment, noting any deviations from normal. Critically evaluate the relevance of each observation to the patient's chief complaint and overall health status. Document all pertinent findings objectively, using precise language and avoiding jargon or personal opinions. This process ensures that the patient's record is a comprehensive, accurate, and legally defensible reflection of the care provided, adhering to the highest professional and ethical standards. Question 18. The control framework reveals that a patient presents with chronic fatigue, poor appetite, and a feeling of fullness in the abdomen. The patient also reports occasional headaches and a tendency towards irritability. The licensed acupuncturist LAC has reviewed the patient's Western medical diagnosis of gastritis. Considering the principles of traditional Chinese medicine, TCM theory, which diagnostic and treatment approach best aligns with the LAC's professional responsibilities? Option A. Conduct a comprehensive TCM diagnosis, including pulse and tongue examination, to identify the underlying pattern of disharmony contributing to the patient's symptoms, and then formulate a treatment plan targeting this pattern. Option B. Focus solely on the Western medical diagnosis of gastritis and prescribe acupuncture points commonly used for digestive upset, without a detailed TCM assessment. Option C. Interpret the headaches and irritability as the primary TCM imbalances and develop a treatment plan focused exclusively on these symptoms, disregarding the digestive complaints. Option D. Prioritize immediate symptom relief by addressing only the fatigue and poor appetite with acupuncture, deferring a deeper TCM pattern diagnosis to a later stage. The correct answer is A. Conduct a comprehensive TCM diagnosis, including pulse and tongue examination, to identify the underlying pattern of disharmony contributing to the patient's symptoms, and then formulate a treatment plan targeting this pattern. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and treating conditions within the framework of traditional Chinese medicine, TCM theory, particularly when presented with a patient exhibiting symptoms that could be interpreted through multiple TCM paradigms. The licensed acupuncturist LAC must exercise careful judgment to accurately identify the root imbalance and select the most appropriate treatment strategy, ensuring patient safety and efficacy while adhering to professional standards and regulatory requirements for LAC practice. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic process grounded in established TCM theory. This involves a thorough assessment of the patient's signs and symptoms, pulse and tongue diagnosis, and a detailed patient history to identify the underlying pattern of disharmony. By integrating these elements, a practitioner can formulate a diagnosis that accurately reflects the TCM understanding of the patient's condition, leading to a targeted and effective treatment plan. This aligns with the ethical obligation to provide competent and evidence-based care within the scope of practice for a licensed acupuncturist. An incorrect approach that relies solely on Western medical diagnoses without a thorough TCM assessment would be a regulatory and ethical failure. This bypasses the core principles of TCM diagnosis, potentially leading to an inaccurate understanding of the patient's energetic imbalance and an inappropriate treatment strategy. It fails to uphold the professional standard of practicing within the established theoretical framework of TCM, which is a requirement for LAC licensure. Another incorrect approach, focusing only on symptom relief without investigating the underlying pattern, represents a superficial application of TCM. While symptom relief is a goal, neglecting the root cause, as understood in TCM, can lead to transient results or the masking of more significant underlying imbalances. This failure to address the root pattern is a deviation from best TCM practice and could be considered a breach of professional duty to provide holistic care. A third incorrect approach, applying a treatment based on a single, isolated symptom without considering the broader TCM pattern, is also a significant professional and ethical failure. TCM emphasizes the interconnectedness of the body systems and the importance of understanding how individual symptoms relate to a larger pattern of disharmony. Treating in isolation ignores this fundamental principle, leading to potentially ineffective or even counterproductive treatments. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a complete TCM diagnostic evaluation, including all relevant assessment methods. Second, synthesize the gathered information to identify the primary pattern of disharmony according to TCM theory. Third, develop a treatment plan that directly addresses this identified pattern, utilizing appropriate acupuncture points, herbal medicine, if within scope and training, and other TCM modalities. Finally, continuously monitor the patient's response and adjust the treatment plan as necessary, always maintaining clear and accurate documentation. Question 19. System analysis indicates a patient presence with reported symptoms of persistent headaches, occasional dizziness, and difficulty with fine motor control in their dominant hand. The patient's medical history includes a mild stroke 2 years prior. Based on your understanding of brain structure and function as it relates to acupuncture practice, which of the following diagnostic and treatment considerations is most aligned with the scope of practice for a licensed acupuncturist LAC? Option A. Recommend the patient undergo neuroimaging to pinpoint the exact location of any residual brain damage, and then attempt to stimulate specific cranial nerves directly with acupuncture needles to restore motor function. Option B. Directly diagnose the patient with a specific neurological sequela of the stroke, such as hemiparesis, and prescribe a treatment protocol aimed at regenerating damaged neural pathways in the affected brain structures. Option C. Identify the specific brain regions affected by the previous stroke and select acupoints that are traditionally indicated for symptoms associated with those regions, aiming to improve circulation and reduce inflammation to alleviate the patient's current complaints. Option D. Focus solely on the patient's reported headaches and dizziness, disregarding the fine motor control issue as being outside the purview of acupuncture's ability to influence neurological function. The correct answer is C. Identify the specific brain regions affected by the previous stroke and select acupoints that are traditionally indicated for symptoms associated with those regions, aiming to improve circulation and reduce inflammation to alleviate the patient's current complaints. Explanation. This scenario presents a professional challenge due to the need to integrate knowledge of neuroanatomy and neurophysiology with the principles and practices of acupuncture, specifically within the regulatory framework for licensed acupuncturists, LAC. The core of the challenge lies in accurately identifying the brain structures involved in a patient's reported symptoms, and then determining the most appropriate acupuncture approach based on established meridian theory and point selection, while adhering to scope of practice and ethical guidelines. Careful judgment is required to avoid overstepping professional boundaries or making unsubstantiated claims about direct neurological intervention. The correct approach represents best professional practice because it acknowledges the patient's reported neurological symptoms, seeks to understand the potential underlying brain structures involved through a differential diagnosis process that aligns with acupuncture's diagnostic framework, and then applies acupuncture techniques to address the symptoms based on established meridian pathways and point functions. This approach respects the patient's experience, utilizes the acupuncturist's core competencies, and operates within the defined scope of practice for LACS, which focuses on stimulating acupoints to influence physiological functions and alleviate symptoms, rather than directly treating or diagnosing neurological diseases. This aligns with the regulatory framework that permits LACS to practice acupuncture for a wide range of conditions, including those with neurological manifestations, by addressing the body's energetic balance and physiological responses. An incorrect approach that focuses solely on the anatomical location of brain structures without considering the meridian system and acupoint functions fails to utilize the foundational principles of acupuncture diagnosis and treatment. This would be a regulatory and ethical failure, as it deviates from the established practice of acupuncture and may lead to ineffective treatment or misapplication of techniques. Another incorrect approach that attempts to directly diagnose or treat a specific neurological condition, such as a stroke or Parkinson's disease, by claiming to repair or regenerate brain tissue, represents a significant regulatory and ethical failure. Licensed acupuncturists are not licensed to diagnose neurological diseases or perform interventions outside the scope of acupuncture. Such claims would violate regulations governing professional conduct, scope of practice, and potentially constitute unlicensed practice of medicine. A third incorrect approach that dismisses the patient's neurological symptoms as unrelated to acupuncture's potential benefits, without a thorough diagnostic assessment within the acupuncture framework, is also professionally deficient. While LACS do not diagnose neurological conditions, they are trained to assess and treat symptoms that may have neurological origins by addressing the body's overall physiological state and energetic balance. Ignoring the patient's reported symptoms without proper consideration would be a failure to provide competent care within the scope of acupuncture. The professional decision-making process for similar situations should involve 1. Active listening and thorough intake of the patient's chief complaints, including neurological symptoms. 2. Applying acupuncture diagnostic methods, e.g., pulse diagnosis, tongue diagnosis, palpation, to identify patterns of disharmony. 3. Correlating these patterns with known acupuncture point indications and meridian pathways that may influence the reported symptoms. 4. Developing a treatment plan that utilizes appropriate acupoints and techniques to address the identified patterns and alleviate the patient's symptoms. 5. Recognizing the limitations of acupuncture and referring the patient to other healthcare professionals when symptoms suggest a condition outside the scope of acupuncture practice or when a definitive diagnosis is required. Question 20. The evaluation methodology shows a patient presenting with chronic low back stiffness and pain, described as a deep ache with occasional sharp, shooting sensations. Palpation reveals areas of taut bands in the lumbar paraspinal muscles, some superficial tenderness, and a palpable sense of restriction in the thoracolumbar fascia. The acupuncturist is considering treatment strategies. Which of the following approaches best reflects a nuanced understanding of tissue types in guiding acupuncture point selection and technique? Option A. Selecting points known for their broad analgesic effects and applying superficial needling to all tender areas. Option B. Prioritizing points that address the facial restrictions and employing deeper needling techniques with electroacupuncture to address the taut bands. Option C. Focusing on points indicated for general back pain and using a standard insertion depth and manipulation technique across all selected points. Option D. Primarily addressing the superficial tenderness with shallow needling and avoiding any techniques that might aggravate the deeper facial restrictions. The correct answer is A. Selecting points known for their broad analgesic effects and applying superficial needling to all tender areas. Explanation. This scenario presents a professional challenge because the acupuncturist must accurately differentiate between various tissue types to effectively select acupuncture points and needle techniques. Misidentification can lead to suboptimal treatment outcomes, patient discomfort, or even injury. The challenge lies in applying theoretical knowledge of tissue histology and physiology to a dynamic clinical presentation. The correct approach represents best professional practice because it prioritizes a thorough understanding of the patient's presentation, integrating palpation, observation, and patient history to infer the underlying tissue condition. This aligns with the ethical and regulatory requirement for licensed acupuncturists, LAC, to provide safe and effective care based on a comprehensive assessment. Specifically, it emphasizes the LAC's responsibility to understand the anatomical structures being treated, including the varying responses of muscle, fascia, connective tissue, and superficial nerves to stimulation. This approach ensures that treatment is tailored to the specific tissue pathology, maximizing therapeutic benefit and minimizing risk, in accordance with the scope of practice for LACS. An incorrect approach that focuses solely on superficial palpation, without considering deeper tissue structures, would be a regulatory and ethical failure. It neglects the LAC's duty to perform a thorough assessment and could lead to ineffective treatment if the pathology resides in deeper facial layers or musculature. Another incorrect approach that relies on generalized point selection without considering tissue type would also be a failure, as it bypasses the critical step of differential diagnosis and personalized treatment planning, potentially violating standards of care. Finally, an approach that prioritizes patient expectation over clinical findings without a proper assessment of tissue type would be ethically unsound and potentially harmful, as it could lead to inappropriate needling or point selection. The professional decision-making process for similar situations should involve a systematic approach. First, gather comprehensive patient information, history, symptoms. Second, perform a detailed physical examination, including palpation to assess tissue texture, tension, temperature, and tenderness. Third, integrate this information with knowledge of anatomy and physiology to form a differential diagnosis regarding the affected tissue types. Fourth, select acupuncture points and techniques that are most appropriate for the identified tissue conditions, considering contraindications and patient comfort. Finally, monitor the patient's response and adjust the treatment plan as needed.